Well, welcome everyone. Thank you for coming today to our session 7 of our Quality Cafe. Can't believe we've done 7 of these already. This is kind of fun. So we got quite a few people on, so that's awesome. Our session today is going to be understanding your star rating. We're going to attempt to talk about long-term care and hospital star rating methods today, and we'll see how far we get and how many questions people have. So normally our Quality Cafe is about 20 to 30 minutes of learning, followed by Q&A. We probably go about 30 minutes of learning, and then we did book this for a whole hour in case we had lots of questions, but we'll see how it goes for that. We do it every other month, so our next one is in October. These were our previous 6 session topics. If you're interested in getting a recording from this, just reach out to Debbie or myself and we can get that for you. Lots of people coming on, which is awesome. All right, so we're gonna get right into it. We're going to talk about nursing home star rating methods first, because I think it might be a little simpler, but as I started digging into it, I realized it's also very confusing. But we'll get started with this one. All right, so if you have questions as we go, just please pop them in the chat. I will not have time probably to address them until we're done, but please pop them in as you're thinking of them so we can remember to address them. All right, so for nursing home, the nursing home star rating program started in 2008. The rating system features an overall quality rating of 1 to 5 stars based on facility performance on these 3 performance measures. You have the health inspections, staffing, and the quality measures rating. And the overall rating is a composite of all 3. So for health inspections, CMS calculated a weighted deficiency score based on points assigned during surveys. They take the most recent survey as well as the previous 2. So the 3 most recent surveys during that period of time. All deficiency findings are weighted by scope and severity as well. So the health inspections rating also takes into account the number of revisits required to ensure that deficiencies are corrected. My slides are very busy, so I think Debbie put them in the chat so you guys could have them for reference, because there's links in there as well if you want to have that if you want to follow along. So the most recent surveys are weighed more heavily than the older surveys. So the most recent one that happened within the last 12 months gets a weighted factor of 1/2, and then the next cycle, which is usually the next year, is a third, and then the one during the 3rd year cycle is a factor of 1/6. So it does taper out as you go. Interesting enough, I didn't know this until I was researching, but the CMS 5-star health inspection ratings are based on the relative performance of facilities within your state. So you're actually compared to all other nursing homes in the state of Alaska with this score. They chose to compare facilities to each other to help control the variations among different states. The rating thresholds are apparently recalibrated every month so that the distribution of star ratings within the states remains relatively constant over time. Interestingly enough, I put the cut points on there just for your reference. And then it's also rated, so you're rated on like a bell curve where the top 10% receive the 5-star rating, the middles get the 2, 3, and 4, and then the worst 20% get the 1-star rating. So essentially easier to get a 1-star than it is to get a 5-star, unfortunately. Staffing is the next group, and the staffing measures are derived from your PBJ, your payroll-based journal system, along with the census derived from your MDS data. CMS identifies facilities with unreliable staffing data. So if you have an NA after your staffing star rating, it's probably because CMS doesn't believe our staffing levels in Alaska. So our staffing levels in Alaska are amazing. And sometimes I don't think that's actually a correct number, and you have to verify that. So if anyone is actually stuck with an NA under staffing, reach out to me. I can point you in the right direction to get that fixed, because I've had to do that before. So anyway, this rating is based on 3 nurse staffing levels and 3 staff turnover measures. The case mix adjusted total nurse staffing and the case mix adjusted RN staffing are given 100 points in the scoring. And the weekend staffing is given 50 points in the scoring, so it's worth a little bit less. And the total nurse turnover and RN turnover is also given 50 points. And then administrative turnover is 30 points. So that's how those scores are rated. Interesting enough, providers that fail to submit any staffing data by the required deadline will receive a 1-star rating for that quarter. And that can affect you for 6 quarters with your staffing, with your star rating. So it's very important to get that data in when it needs to be in. The next metric is the quality measures rating. It's based on 15 quality measures, 9 long stay and 6 short stay. The rating is calculated using the 4 most recent quarters, which the data is available. I have a little more information further on. And they use this really simple calculation to get it done. Let's see. The QM ratings are based on performance on a subset of 10 MDS-based quality measures and 5 measures that are created using Medicare claims. And so I just pulled up the long stay resident. Most of our facilities here in Alaska are don't have as many short stays. So I just pulled the long stays up for reference. So these are the quality measures for long stay residents and that are done through the MDS. And these are the claims data measures for long stay residents. So number of hospitalizations per 1,000 resident days and number of outpatient ED visits per 1,000 resident days. And I got a link in there for you to get to that information. I didn't put the whole data set in, but for the quality measures reporting, this is the measure date ranges. So you can see that for that claims measure for hospitalizations, it's for the current quarter, they're collecting data from all of 2023. So this data is also a little bit, so it's a little bit behind. Same for the ER visits. Some of them is earlier in 24, and then pressure ulcers is one that looks back a lot further into that one's got some data from 2022. So it does take a little bit of time to move the needle if you're low on any of these quality measures. So scoring rules for the individual quality measures, the 2 different sets of weights are used just like before. So things are scored on 150 points or 100 points. So I put a list just for a long stay here of the quality measures with a maximum of 150 points are listed here. And then the quality measures for 100 points are listed there. So some of them are weighted more than others. And there's a few reasons they did it that way. Some of them are measures that you can affect more than others. So the overall nursing home rating is so based on the 5-star rating for the health inspection domain, the staffing domain, and the quality measure domain, the overall 5-star rating is assigned in using these 3 steps. So it's kind of interesting. I'm just going to read them out. So step 1, you start with your health inspection rating. And then you add 1 star if the staffing rating is 5, subtract 1 star if the staffing rating is 1. The overall rating cannot be more than 5 or less than 1, obviously. So if your staffing level is a 2, 3, or 4, it doesn't change your overall rating. You have to either have a 1 or a 5 to make that change. Step 3 is you add 1 star to the step 2 result if the quality measure rating is 5 stars. Subtract 1 star if it is 1. So the same thing. If you have a quality measure rating of 5 stars, that will bring you up 1 point. If you have 1, it'll bring you down 1. If you're 2, 3, or 4, it doesn't change it at all. If the health inspection rating is 1 star, you must stay at 1 star, according to this. And I don't think we have any special focus facilities right now in Alaska, but you do not get a star rating if you have a special under their special focus program. You just get a yellow warning sign that says that you're part of that program. So how often does the star rating change for nursing homes? So the health inspection rating can change whenever the state CMS updates it. So once your plans of corrections are complete, accepted, and you're back in compliance or your survey is complete, they can update that data. So if you have a new survey or revisit completion, any dispute resolutions, complaint or focus infection control surveys, if they age out over that 3-year period, that will happen. Or if you have the abuse icon on or off, that will change your that will change that will change that. The staffing rating is updated quarterly, and the quality measure ratings are updated quarterly during the Care Compare refresh, which is usually January, April, July, and October for that. So preview reports are, I encourage everyone to get into their Casper and look at their preview reports to help them understand how their rating is calculated. And here's the instructions here, and the link is to a flyer with all that information. So that was a super quick and dirty on nursing home quality ratings. We have just a couple minutes allocated before we have to move on to hospital. If you have any questions, burning questions, ask them now. But if you have any others, you can put your questions in chat and I will try to address them at the end of the presentation. If we run out of time, I will send answers to the group once I have had the time to research the answers. Looks like I got something on there. You can also send me an email. Oh, Debbie just put the slides back in. Awesome. Don't see any burning questions. I hope that was helpful for nursing home. So we're going to move on to hospital now, the other part of our group today. So the hospital star rating is also made up of 1 to 5 stars, and it's made up of these 5 categories. So in 2024, the overall hospital star rating selects 46 of the hospital quality measures that CMS publicly reports on Medicare.gov and divides them into these 5 groups: mortality, safety of care, readmission, patient experience, and timely and effective care. So within each category is a set of measures that the hospital submits to CMS through inpatient quality reporting, outpatient quality reporting, PAC reduction, and some claims data as well. There's lots of different avenues that the data gets in there. So not every hospital gets rated. To get a star rating, hospitals must report in at least 3 measures in at least 3 groups, including one of those has to either be mortality or safety. So we'll go through this a little bit more, but just think about it as we're looking at these groups, that in order for your hospital to have a star rating, you must report 3 of the measures in 3 of the groups, 3 of 3. These are the mortality measures. And I put the data range in here just so you guys could see. So for the current star rating reports that are out, that came out in July, they're pulling data that started in 2019. And if you see any asterisks on this one, all has asterisks. If it went through 2020 with some of the COVID times, what's the word I want to use? Kind of stopped measuring for those couple quarters so that facilities had time to work on their COVID responses. Safety of care, these are the safety of care measures, and there's 8 of them, and you can see the reporting dates there are a little bit more recent. So for safety of care, you have to have 3 measures in this to get your star rating, and you either have to have something in safety, you have to either report safety or mortality. It's kind of confusing, I know. Here are the readmission measures and patient experience. These come through HCAHPS, and I did find out in research that hospitals with fewer than 100 completed surveys don't get a star rating for HCAHPS. So that kind of leaves us at some of the bigger facilities. Smaller facilities have trouble getting that many back in a 12-month period. And here's timeliness and effective care on the measures for that. There's 13 of them. And so remember, you have to be reporting 3 of them to get this group. All right, so once you have your groups, just wanted to talk a second about Z-scoring. So CMS standardized the measure scores. They take the hospital performance on the measures and standardize the score so it makes sense in the overall equation. So think about taking kind of things that you want a high score on versus things you want a low score on and doing the Z-score to make it happen. So here's just an example from the patient safety section of how that is scored. And then for each hospital, hospital summary score is calculated by taking the weighted average of the hospital scores for each measure group. So the table shows the weight applied to each measure group. So I just brought in one example that had all the measures. So if your hospital only reports, 3 of these items, then each thing will be weighted at 33%. So it's just a straight average. And then if you only, so these are the whole 5 measure groups and how those are weighted. So mortality, safety, readmission, and patient experience are all 22%, but timely and effective care is at 12%. So it's weighted a little less. But if you're only reporting 3 of them, then they will weight that out accordingly. So it still makes up to 100%. They just use a simple average. The only thing they use a simple average for. Then we get into peer grouping. So the peer grouping was introduced in 2021, so it's relatively recent, with the goal of making the star rating comparisons more of a like-to-like basis. So hospitals are put into one of 3 peer groups based on the number of measures they submit. So you can see the hospital by peer measure group. So majority of the hospitals are landing at the 5 measures. There's 79% of the hospitals in the July update that were in the 5 measure group. 16% in the 4 and 4 in the 3 measure group. And I have a reference on there for your information. Then once you're peer grouped, they do this fancy k-means clustering analysis to then figure out what your star rating would be. So within the peer groups, the scores are split into 5 groups using the k-means clustering method. I'm not sure if I quite understand what it is, but essentially the k-means clustering is an algorithm method which aims to make the hospital scores results within a cluster more similar to each other than to a different cluster. Basically, they're looking for the bell curve. And the 5 groups are the 5 stars. And so it's going to be, a lot easier to get the middle 2, 3, or 4 stars than it is to get a 5-star or 1 star. So you're put into a group as to how many measures that you are grouped reported, and then you're compared against all your peers to put into the star rating. So the peer grouping is kind of private. You can log into your hospital specific report to see what group you're in, but you cannot easily find out who your peers are in that group, or and it's not publicly reported. All right, so this is a nice graphic. I wanted to just summarize the 7 steps for the star rating methodology. So step 1 is the green, the selection of the measures. So in 2024, there were 46 measures that comprise the star ratings. If you report them all, there's 46 of them. And then in step 2, the purple, the 46 measures are grouped into 5 groups, those 5 main groups. Step 3, the group scores are calculated depending upon what measures the hospital is reporting. So your score is counted off that. And then in step 4, a summary score is calculated for your hospital. I skipped step 5. Okay. In step 5, they apply the reporting thresholds. So hospitals must report at least 3 measures in these 3 groups to obtain the star rating. If not, you are excluded. And one of those groups must be either mortality or safety. And then in step 6, they apply the peer grouping, depending on how many you have. And then in step 7, they calculate the star ratings within those peer groups using that k-means clustering algorithm. Hope that's clear as mud. All right, so for your hospital specific reports, you can get, it's an Excel spreadsheet that includes your overall hospital star rating, your group score results and the weights, your individual measure results, and your peer grouping. The link that I put there takes you to how to get to those reports it's in your HARP HQR account. I really whizzed through the hospital star rating, so we do have time for questions. Feel free. That Jay, so glad to see they make the calculation so easy to follow. Correct. I'm still lost on the K score, K means thing, but I'll figure it out eventually. So, we do have some time for questions. You have any questions on either hospital or long-term care, you're welcome to pop them in the chat, send them to me by email, or unmute and answer your questions. No, I'm not that good at presenting, so I'm sure there's something going. All right, everyone's being quiet, which is absolutely fine. So there is a quick survey when you leave the Zoom meeting. So take a minute to complete to help us improve this quality cafe offering. And you can also put, if you have a question in there, I will do that. If you think of something after the fact, you can certainly send me an email, and as I get questions, I can respond with answers to the whole group so that everyone has that. So with that, I think, Debbie, if we just stop the recording and then see if anyone has any final comments. I thought I'd be going really long today. So